Welcome back this morning. Today in our Sunday Spotlight, hair loss. Many of those who experience it spend a lot of money fighting it, but there could be another option. Dr. Brett King is a dermatologist and associate professor of dermatology at the Yale School of Medicine. Doctor, thank you very much for being here this morning. We appreciate your time.
It's my pleasure to be here. Thank you so much for the opportunity.
Well, it's interesting because obviously, as we said, this impacts a lot of men and women. But I want to talk first about really what I think is the most common treatment, right? Minoxidil. What is that and how does it work?
Yeah, so there are two FDA-approved treatments for androgenic alopecia, meaning male pattern hair loss or female pattern hair loss. One of them is topical minoxidil, which the brand name is Rogaine. And then there's also, for men, low-dose oral finasteride, which is typically given at higher doses to men with enlarged prostates. But these two medicines are the only two that are FDA approved. And the thing is, they don't work particularly well in the vast majority of people in which they're used. And so there's really a lot to be done in this space. And it makes the story of oral minoxidil particularly exciting.
This regular treatment you've been using is costly, right?
So topical minoxidil, costs somewhere between $10 and $50 a month. Oral finasteride costs, again, probably, $50 a month. And then the thing is, hair loss creates so much, often despair. People want to try so hard to keep their hair that they're willing, often anyways, to pay a lot of money for a whole lot of treatments for which there's very little data to support them. But again, people are so desperate that they often do pay a lot of money for things, again, for which there is very little data. Again, making the story of oral minoxidil particularly exciting.
And that's really what you're talking about here. It's just a pill. How often would you take it, and what are you seeing? What are the effects of it?
So oral minoxidil, briefly, the story is fascinating. We're talking about a medicine that has been around since the 1970s and 1980s as a treatment for severe high blood pressure, meaning it's a medicine that can bring down or lower blood pressure. It was recognized in the clinical trials of oral minoxidil in the 1970s that people were growing hair with taking it. And that's what ultimately gave rise to topical minoxidil, again, which goes by the brand name Rogaine, for the last almost 40 years. It has only been in the last handful of years that we have started administering it orally in our patients with hair loss, but at lower doses than are typically used for the treatment of high blood pressure. And the results are frequently amazing. And so you have a pill that, by virtue of the fact that it's been around for so long, is really inexpensive and happens to, I think, very likely work better than the two FDA-approved medicines and works far better than the things that people are paying countless dollars for, but are being told they should do for the treatment of their hair loss.
It's interesting, when you look at the pictures online, the growth has been really incredible over, several months, and you see that in both men and women?
See it in both men and women. We see it in 18-year-olds who started losing their hair far too early. We see it in 70-year-olds who have only started losing hair in the last 5 or 10 years. In men and women, it's a profoundly interesting medicine with very few side effects. I think mostly because we're using it at lower than typical doses. And again, the effects, range from, maintenance of what you have, which is hugely important in and of itself, to significant new growth of hair that has been lost. And so, and again, this is not say that it works for everybody, but I would say that the data that we have suggests that it works for the majority of people. And so it's an unbelievably exciting time for people with this problem.
I'm curious.
There is often a solution.
You say it's exciting, doctor. I don't mean to cut you off, but I'm curious because not everybody really knows about this, though, right? Including a lot of doctors don't necessarily prescribe it. Is that true?
I would say that the vast majority of dermatologists do not use it, and we're hoping very much, right, with the recent news coverage of this topic, emerging medical literature supporting it. I sincerely hope that we're going to change this over time to make this accessible to people.
Is it a matter of folks, people watching this need to approach their own doctor or their dermatologist perhaps and talk about it?
Absolutely. This is just true always in life, but especially in healthcare, right? You have to advocate for yourself. If somebody's not, if you have a question about a treatment and somebody is not spontaneously offering it up, you need to ask and hear, from somebody who hopefully knows something about why it might be right or not right for you. But absolutely, people need to advocate for themselves.
Well, we have very little time, but you are very excited about this, and I'm imagining you think this is a game changer for sure, right?
It's absolutely a game changer. There's no question about it.
Dr. Brett King from Yale School of Medicine, thank you very much for joining us this morning. We appreciate your time.
Oh, thank you so much.